Hello, I'm Paul Skousen, and this is the Healing of America Project. Yeah, the primary idea of socialism is that the government provides everything you need. That's their promise. And one of those promises is national health care. A lot of countries have adopted that. England has their national health care service. It's been around for ages, and they say it's a fantastic thing, but it isn't working as promised. Nothing beats the free market system. So the first question to answer is healthcare a personal right? Is that an unalienable right that I get healthcare? The answer is no, it's not, because an unalienable right never imposes on other people. Well, when you ask a doctor or a nurse to come care for you, you're imposing on them. When you ask people to build hospitals, they're being imposed upon. So you compensate by giving them money. That's what you do. You pay for the building constructors. You pay for the nurses, the doctors, the administrators. You compensate for their expertise and their time. And when you reward them, what do they then do? They want to become better because they want to get more. They want to be paid more. They want you as a customer. And so they happily go make their expertise more refined, more broad, more capable. And so when you have a serious life-threatening ailment, every dollar you own and every asset you own is going to happily go to that doctor to save your life. It's a good system. So a lot of people look at their tax dollars as an investment into that national health care system. The reason that fails, the reason it has never worked and it simply cannot work, is because all of the motivations, all of the corrections that the free market brings, all those are done away with. Under a government system, as long as the paycheck comes into the doctor, there's no motivation for the doctor to improve his or her capabilities. National Health Service over in England is a beautiful example. Here we have doctors and nurses and staffers that are paid the same no matter what they do. If they make a mistake, doesn't matter. Oh yeah, they might get slapped, or they could get fired if it's severe, but generally speaking, they have no reason to improve themselves. That's the failure of a government-sponsored anything. It always falls short because it doesn't correct itself. It's not incentivized to be better. And you see inefficiencies. I love our military forces, men and women working really hard, but the inefficiencies from the government aspect, it's enormous waste. And those who are in it can tell you that as well. Look at World War II. Horrific waste. Over in England right now, I had a friend who was living over there for a couple of years and going around on a bike, fell and hurt his arm. And his arm, it stayed. After about 10 days, it still hurt. So my friend went with his buddy into the National Health Service facility and talked to a doctor and said, my arm hurts. And the doctor felt along. He says, where does it hurt? He says, right there. And he felt for a minute and he says, okay. You know what the doctor prescribed? Pain medication. He says, this will help with the pain. That was it. Well, he didn't think right. It didn't feel right. It tingled. So he went to a private hospital over there in London, a private facility. They x-rayed it. It was fractured. So they had to do some setting of the bone, and then they put him in a cast. That was the private system. The public tax systems, they're not incentivized. They did a little study over in England also where they paid doctors more money to do this procedure. Not a lot, but just more. And everything else stayed the same. And after 6 months, more doctors were doing that test, that procedure, and were not doing the other one because they were getting more money. It just doesn't work, this government system. So as we pay into our government, pay taxes for the Affordable Health Care Act, or Obamacare as people call it, we're getting the same processes. We're not getting all those wonderful, beautiful institutions of health and motivations and incentives to do more. Today, people from all over the world fly into America or where Western medicine is well practiced because the care is so much more refined and precise. So in a socialist society around the world, national health care just has not been working. So to adopt that into our country, we're inviting all the same problems, all the same drawbacks, all the same minimums. Already today, we see the impact of Obamacare and how it's hurt our country. A lot of people are saying, oh good, I don't have insurance. But the insurance they get is inadequate, and they're not taking advantage of what's supposed to be a benefit. They go to the emergency room of what? Of a privately owned hospital, which by law must receive them, and they get top care. They go into doctors that are receiving Medicare patients, welfare patients. They're under that government oppression. The doctors are not as attentive. They don't have as many resources available, and they get a lower quality of care.